Hey, thanks for taking a minute to watch this video. Because we do so many sleep consultations and talk with so many patients about sleep apnea, we've condensed this to some key things we think you should know. And today, we'll share with you a little bit on how to sleep better. Okay, so whether you heard about us from word of mouth, you're an existing patient, or you were referred to us from your physician or your healthcare provider, we'll go through some things on what we found with sleep apnea. Okay, so the three things that you'll find that benefit you with a sleep appliance. The first one is, obviously, you can breathe and sleep better. Okay. The second one is, it protects your teeth. Okay, so most people we find with sleep apnea will also clench or grind their teeth. You may be doing that and not even know it. And so it protects your teeth from breaking, cracking. If you've had lots of root canals, lots of crowns, lots of cavities, if you have dental implants, there's a good chance that either now or at some point you've been clenching or grinding in your sleep. The third thing about the sleep appliance we really like is they're comfortable. So with a CPAP is positive airway pressure. So a CPAP you wear, and it's a big mask on your face, and it blows air down your airway to help you breathe and get more oxygen. With sleep apnea, it means that you stop breathing or your breathing slows way down to an unsafe level a certain amount of times per hour. So you get this number called an AHI. And usually with sleep apnea, people are between 5 and anywhere to 100 on the high end. If you're 100, that means 100 times per hour you stop breathing or you almost stop breathing. If we can get you below a 5 while you're wearing this appliance, we call that a super success, because that means that clinically when you're asleep, you're not having the symptoms of sleep apnea. Now, the advantage of a CPAP, and the reason CPAPs are the gold standard, is they are very effective, which means most people who use a CPAP will receive benefits from it. Meaning, if you have sleep apnea and you stop breathing and you wear this big mask, you're likely to breathe better, sleep better, those kind of things. The disadvantage with the CPAP is almost 2/3 of people either won't wear it, or they wear it for a while and they quit, or they don't wear it consistently enough. So what we found with the oral appliances is the compliance is much higher. The downside with the mouth appliances that we have, I have one here for you to kind of see. The downside with these is that they may take more adjustment, or it may take a little longer to find that sweet spot. So it's kind of like a muffler on a car or tuning an engine. We have to find that sweet spot. A lot of times we're talking just 1 or 2 millimeters make all the difference. So with the the CPAP, the advantage is they work very well. Disadvantage is most people don't wear them. Disadvantage with the mouthpiece is some people, maybe 10 to 20%, these do not work for, and they can take a little longer to fine tune. The big, huge advantage with these is the compliance is much higher. People wear these more regularly. If you've worn a CPAP, you'll know how cumbersome they can be. These are very comfortable, easy to get used to, and then they also protect your teeth, and they use open airway therapy. What that means is when you lie down, instead of your jaw falling backwards or your tongue falling backwards, this gently positions them in the right place so that your tongue doesn't block your airway and you can breathe and sleep better on your own. Some people we have wearing a CPAP over one of these, not very many, but sometimes we do that. When you leave today, we will give you a demo sleep appliance. You can try one out for a couple weeks and see how it feels. These are kind of a one-size-fits-all anti-snoring appliance, so they're not meant for long-term use, and they may not, it's definitely not going to work as well as the real thing. But it does take us a couple weeks because these are precision made in the lab and they're customized for each patient, so it takes us a few weeks to have those made. We'll go through some questions with you today. One of my team members will ask you things like your medical history, surgeries. We look at if you're having any muscle or joint pains anywhere. We take all these things into consideration. We even look at your posture, right? We can actually tell by someone's posture how likely they are to have sleep issues sometimes. If you have a forward lean, your stance, if you lean a little bit forward or a forward head tilt, it's a good chance that you're more likely to have sleep issues. Now, do these fix snoring? No, they do not, okay? Not every time. Sometimes they do, but you may still snore after. That's okay as long as that number we talked about in the beginning is going down to a safe level. So some residual noise may happen. As we age, the muscles in the back of our throat, they get more tired, they lose their elasticity, they sag a little bit, right? In the future, we may have some laser therapy and things we can do to fix that. But as of now, we know that some sound, some noise may still happen. That's okay as far as your health goes, so long as you're wearing an appliance or CPAP. A lot of people are taking vitamins. You may be taking some supplements. If you are, make sure you take them with food that has good fats in them. We found that you will absorb them better. The mistake a lot of people make is they'll take a vitamin or a multivitamin, maybe vitamin D or calcium. Those are some common ones that people with sleep apnea take. If you are taking those, making sure you're taking them with healthy foods, avocado, grass-fed meats, your nut butters, those kind of things. Better fats, you'll absorb those. If you just drink it with water or coffee or orange juice, a lot of those vitamins will just go right through your system and you'll get very little benefit. We also may have your physician do some blood tests to check for some of these vitamin levels. And we may also see you for some follow-up home sleep tests. A little device maybe take home about a month after you get your new appliance, and you'll wear that at night, and that just tests you with the appliance. We'll also want you to see your physician or your sleep doctor to also check those studies and see how you're doing. But we want you to wear this new appliance for about a month before you go in and get the test done, because there's a little bit of an adjustment period. Now, a lot of people get these the first night and they do just fine. A lot of people are doing very little to adjustment on them. But if you do need a little bit of adjustment, it takes a little longer to get used to it, or you have a spot that maybe presses on a tooth or needs some adjustment, just be patient with it. You will be able to adjust, likely 80% of people are, and that should get you feeling better. So thanks for taking a minute to watch this video. We look forward to helping you. Keep in mind, this is a journey. It's not a one-time appliance you get and see you later. We want to be here to support you and help you, depending on which package you select, because we have a few options with these appliances. We may see you more or less frequently, but we will stay in touch with you and your healthcare provider, keep you in the loop what's going on. And please call us with questions. We will send you home with some instructions when you come back in a few weeks to get your final appliance, and those will go through things like how to care for it, things to look for, things to talk with your physician about, and this should work out great. So we hope this helps you sleep better. We hope it helps you protect your teeth, and we hope you're more comfortable, and have a great day. Thanks for watching.